Hi everybody, my name is Mike Henson with No More Excuses. One of the things that we've done over the last 2 years is to bring you numerous cases of NurOwn trial interviews. In other words, people who have been through this trial. I myself completed this trial last year, and over the last couple of years, No More Excuses has really taken the lead on trying to convince our world, our society, if you will, and even our own ALS community that this drug is truly worth fighting for. I hope you find today's interview to be further evidence that we are making a huge mistake by keeping this drug away from people with ALS like you or your loved one. You're going to hear and see a lot of positive things today, and I just want you to know that those positive things are what ALS needs. As patients, we must stop the ALS defeatism that has pervaded our disease for so long. The gentleman you're going to meet today, named Scott Craig, he lives at Lake Tahoe out in California. I believe you'll find him to be extremely credible. He is also one of the people who kept his own data via the ALS TDI Precision Medical Program and ended up with a higher FRS score than he started the trial with. Now, I want to give you a disclaimer. This trial was a 50-50 placebo trial. That means we don't know for sure who got the real drug and who got the fake drug. One thing I can tell you is that now this is my 11th NurOwn interview, and everybody has said the same thing to me. And that is that if this is placebo, I want more. Probably one or two of those, I suspect, in the end, will be discovered to have been placebo. No doubt. But the evidence is just becoming too impressive and too overwhelming to deny these people anymore. Please watch this interview now and let me know what you think. Thank you so much. All right, everybody, and with that, now let's bring in Scott Craig, NurOwn Phase 3 trial participant. Scott, how you doing today, bud?
I'm good, Mike. How are you?
Oh, doing great out here in Oklahoma. It's freezing cold today. And tell us where you're from, Scott. Introduce yourself a little bit, and then we'll go from there.
Hi, everybody. My name is Scott. I live in Lake Tahoe, California. I'm 52 years old. I was diagnosed with ALS almost 2 years ago in March. I'm a restaurant guy. I've been in the restaurant business. Lake Tahoe is a great place to visit.
I've heard it's stunning,
spectacular, but
man,
it snows too deep in the winter.
So Scott, tell me just briefly, what was the first moment you thought something might have been wrong, and when was that, if you don't mind?
I was having spastic. Now I know them now as spasticity.
Right.
I was actually on an airplane going to Guadalajara, Mexico. Whoa. For a wedding. I thought I had drinking too much coffee, and I was vibrating, twitching. Yeah. Right. And which is possible, you know, and
sure. That's how it started for me.
Too much coffee, not enough sleep. And, you know, and that's looking backwards. I was like, huh, you know, that's odd. And then about a month later, it happened again. About a month after that, I started getting fasciculations in my forearm and my tricep of my left arm. And I just fortunate enough to have a good primary care physician that took the time to pay attention. And she sent me to a local neurologist. And long story short, they told me ALS, and literally I thought it was cliche. Yeah. Like, here's your pamphlet. Go home. I mean, read it off I was stunned. The neurologist sent in the assistant.
Oh my God.
And she came in and handed me a pamphlet and said, You have 2 to 5 years to live. Go home and get your affairs in order. There's nothing more we can do for. Oh yeah, I never went back, but it was like wow.
For people out there watching, this is something that's like Scott basically, you kind of just said there. It's like a movie, right? Like that moment where your vision goes like this, and all of a sudden you have that panic feeling. This is part of why this drug is so interesting and so amazing, and so why we just have to have approval, because this is what you're told with ALS. This is the reality of ALS. You are told, in many cases, not even by the doctor. And by the way, that's not good practice. He's not supposed to do that. But you're told that you're dying. There's nothing you can do. And you're given a booklet. I was handed that same booklet, same pamphlet, a prescription for Valium because of the trauma, and sent out the door and told to go home. And that's it. Like, there's no instruction manual for ALS. Tell me how you got from that terrible moment to the next phase, which is where you got into the NurOwn Phase 3 trial.
I basically turned to the internet and Facebook and found you, Mike, along with some other people who were leading the way. Wow. And I had an aha moment. I also knew that I was in trouble, and that if I didn't become my own advocate, I was sunk. I went to the Brainstorm site, the website.
Yep.
And I emailed every site, and I got a reply from Southern California and San Francisco. And I called down to San Francisco, and I got in. I
Awesome.
jumped through all the hoops, and
Yep.
and if it wasn't for the internet and Facebook, nobody told me anything. Nobody. And which is, you got to try to have faith in the medical system. But whatever, and so I got in, and as I told you earlier, I was second to the last to get in at California Pacific Medical Center at Forbes Norris is what it's called, and they were wonderful. And by the grace of God and sheer luck and whatever, I got in, and
great.
And grateful.
Now here we are, and we're going to hear your story today. So you got into the trial. Now, a lot of people may not understand this. People with ALS, some of them do, but this trial is very rigorous. It's 14 visits. And for some of us, it was literally traveling. For me, it was going from Tulsa, Oklahoma to Boston. No direct flights. I always either had to go through Chicago or Charlotte. And at our own expense. There is a small reimbursement, a little bit that helps. But for me, it cost close to $20,000 total. But this is pre-COVID when I went. So hotel rooms were still $350 a night in Boston for a cheap one. Now imagine that going through these airports in a scooter or in a power chair, very difficult. And for you went on that first visit and spoke with those great people who do the screening. Tell me a little bit about your first visit when you walked in. What did they tell you, and what did you expect when you walked in?
That was a year ago, over a year ago. Mm-hmm. So actually, just to get the first was a series of phone calls where they, I guess, pre-screening. Okay. Where they ask you, what supplements you're taking, what your score, and so I went through that phone call a couple of times. But my first visit, fortunately, I could just drive down. It's about 4 hours, and going to San Francisco on a sunny day isn't terrible. I wasn't sure what to expect and I was very surprised and pleased, because up to this point it's been very discouraging. I was, reinvigorated.
Were you progressing quickly or slowly? That's pretty much the only way we'll leave that.
Well, it depends on who you ask, but I was progressing quickly in my mind.
Okay.
And by the time that I got my first injection in January,
okay,
I dropped down to, I think it was down to a 34
okay.
at that point. And, I was concerned. I mean, I was concerned for myself. And I was, walking with a cane,
right?
Poorly.
I think it's either visit, let's see, 4th visit is the bone marrow aspiration, right? And then visit 5 is the first injection, if I remember correctly.
Yeah.
Something
the bone marrow aspiration, that was no big deal.
How'd that go for you? Did it go good when they took out your bone marrow?
Out, no problem, good. No pain, no nothing.
Great. Tell us about that. What does it feel like as an ALS patient? Because I know what it felt like for me. It was very emotional. But what does it feel like to be getting an injection of something in your spine, to know that whether it's placebo or real drug or not, and I have to throw this in here, it was 50-50. We don't know what we got for sure, but what does it feel like? Tell our fellow ALS patients what it feels like to know, or to feel like you're getting treatment. You know what I mean?
I was scared to death.
Yeah.
And I was by myself. I was traveling by myself, but I was so hopeful and faithful, and I was excited. And the sooner that the trial was over, the sooner I could get the medicine. Either way was fine with me.
That's a great attitude.
And so, yeah, I was very enthused. And the way that they conducted themselves just gave me so much hope.
Yeah.
That, you got to make the best of things. So
absolutely. You're laying there, you're getting that first injection.
The injection itself was fine. The procedure was fine.
Okay.
A little bit of pain, but no big deal,
Yeah.
And then they make you hang upside down for a couple hours or whatever the case may be. And then they keep you for 24 hours, like flipping a switch. 1 minute,
yeah,
I had a headache. Next minute, I was fine, and they released me shortly after. I was fine. I really didn't notice anything for about maybe 5 weeks.
Okay.
At first for a while, I was like, I didn't feel any better, didn't feel any worse. After about 5 weeks,
okay,
I had so much more energy. I was like, oh, something's going on here. I just started to feel so much better.
Wow.
And from that point forward, I got to the point where this is where I knew something was up. I forgot my cane.
Okay.
I went out, got my truck to go to work.
Okay.
And when I got to work, I go to get out of my truck, no cane.
Okay.
And so I felt good enough. I was absent-mindedly just left my cane. But from there going forward for quite some time, I was walking without my cane, or maybe at the end of the day, if I was tired, no cane. My left wrist, my wrist drop gone. Wow. And never used the BiPAP.
Now, if I can just cut you off there for a second, when you say your left wrist drop was gone, be a little specific about that. Are you suggesting that maybe your left wrist was working a little better than it had been? I mean, tell me a bit about that, and be as accurate as you can if possible.
Okay. It was becoming such an issue that I put the wrist brace on so I could have strength driving or doing whatever,
right.
Reinforcement.
Got it.
And I got to the point where I stopped needing to use that brace.
Wow.
If that's a more specific
it is.
answer.
So you feel like you could stabilize it more. It felt stronger in a sense, if you will.
Yes. Yes.
Wow. That's awesome.
And it's actually been that way until just about maybe 2 months ago. It started, going backwards again. What are the progression and regression?
Of course. Which, by the way, I'll interject here is what we expect, Scott, because NurOwn is not a cure. I want to be cautious about this. I certainly believe that if this drug were given to all newly diagnosed ALS patients, it could actually be a functional cure, meaning that it's not going to cure the disease, but it might allow a person to remain functional for the duration of time that they receive this therapy. Yeah. So we can't call it a cure. It's not that. And I've also heard people say, well, it has to be repeated, and that's in some way a bad thing.
We've seen cases where people got better very quickly, but we don't know enough to say that they actually stayed better.
Going through this procedure once every few months is nothing compared to having ALS. Do you agree with that statement? And what is your
yeah.
Okay.
No, I do it once a week if I had to.
Right.
Of course. I don't care. It was no problem.
Well, and some people have to do dialysis every day. Let's face it, Scott. So actually, for us to have to go, let's say it's every 90 days, which it could be. We don't know yet. But if it's a lumbar puncture every 90 days, man, sign me up.
So my second injection was supposed to be March 15th. I did not get it until May 12th.
Okay.
Till May 12th. I could feel the NurOwn wearing off at that point.
Okay. Right. Because you'd only had one at that point.
Because I was feeling good. I don't know that I had it, but I either I got it or I convinced myself that I got it, but I was feeling good.
So you go back and you get number 2. What happens after you get number 2?
Number 2, I had no problems whatsoever. I was released in 24 hours. No big deal. Go home. And I felt great. Just more of the same. My decline, it didn't stop.
Okay.
It didn't stop. I was highly functional. Mm-hmm. I was highly functional. Mm-hmm. And again, I was intermittent use of my cane.
Wow.
I was for a while. My fasciculations never stopped.
Okay.
But I did have, at one point, I had a bunch in my face, and which was no fun. Right. And those went away.
Annoying.
Those went away. They never come back.
Wow. Okay. Okay.
So whatever that means.
How was your wrist holding up after number 2? By the way,
Same.
Oh wow. Okay.
Same.
Okay. Good. Okay.
Same. And still, and at this point, so I was also still going to the ALS clinic at UC Davis,
right?
Just maintaining those visits, and my forced vital capacity went up 10 points.
Wow.
At my visit there shortly.
That's great.
End of May, 1st of June, had gone up from, I think it was 75 and it went up to 87. And because
mine went up 11 too, though. Mine did too, but so.
Part of the problem with the COVID thing was they stopped doing those tests.
That's correct.
But so which was great. I was happy that my breathing, and I could tell.
Did you have that same effect after injection 2 that you did on number 1? In other words, did you kind of start going down a little bit, and then, or did it stay more flat before you got that in that extra month time period?
It was flat. It was flat or up. You know, because it was so close.
Mm-hmm. Yeah.
You know, it was only a 30-day. I had mixed feelings about the scoring system. That,
Of course.
you know, it's
very inaccurate.
Very arbitrary.
It is. It is.
But I was using the TDI ALS TDI. You can go on.
Oh, great! Their precision medical program. Yeah, PMP.
Yeah, you can track your own score.
Great.
So in January I was at 34.
Okay.
In sometime in April or May, I was all the way back up into 39, 40, and 41 by my own score. I'll tell you how good I was feeling. I left after my 3rd injection. I went and bought a convertible Corvette.
No, you didn't. Did you?
Yes, I did. Oh my! Yes, 2006.
I love it.
You know, ALS. You know, and from June to Thanksgiving.
Love it.
Going out and living life, and I'm fully convinced it was because of NurOwn.
So, yeah, and you're after injection 2 now. So tell me a little bit now. You know, this is your final injection coming up. Did number 3 go okay? And how was injection 3? And what did you know?
I had 3rd injection went as well as the rest. I did have some residual pain after the injection, but it was a sciatica type of pain.
Right.
And it hurts. That if you ever had that type of pain,
I have.
It was far from debilitating. It was just
right.
This pain, like a bruise. You know, I felt great. You know, like I said, I was driving my car all over, and I felt. There were days where I felt like I did not have ALS.
Wow.
You know, I knew that I did.
Of course.
Yeah. And like you said, I will never say I was cured. I never felt like I was cured.
That's right.
There were days where I woke up and I was like, okay, I feel pretty damn good.
That's amazing. In ALS, you know, earlier on, I wouldn't really say earlier on, because at that point you started this trial according to the PMP data at like the 35-ish, somewhere in that range. So, talk to us about after the 3rd injection. Were you still using TDI's precision medical program, and how did that end up for you?
Yeah, I have. I have to go back and look, but I started to come down in score.
Okay.
Let's see, about September.
Okay.
About September, I started, just.
Well, yeah. How many months? How long after your 3rd injection was that, if you don't mind me asking? And when you said
well, that would be whatever, June 15th to September, mid-September. So
okay.
3.5 months.
Okay.
4 months, maybe. Started to fall off.
So let's say 3 months. Yeah.
And
wow.
Yeah, 3 months.
Wow.
But as I started to fall off, it was certainly slower.
Okay.
And so what is this, January now?
Yes, it is January. So,
and I think my last score was a 36, 37.
Okay.
Depending on who you ask me, how you count it, and what day it is.
Okay.
And, so basically, according to the ALS, FRS, ABC score, from January to January. A year ago, I was at 34. Today, I'm at a solid 36. So I've had, arguably, I've had zero progression in a year. I went up and I went back down.
Wow. That is incredible. That is truly incredible.
I can still drive.
I ask people this, and I ask them to be very, very comprehensive in there and how they answer this, and to really think about it. Make sure they're not just giving me an answer. In retrospect now, in hindsight, now that you've been through the trial and that it's been a couple of months, actually 3 months since your last injection, and you're having a little progression again, which we expect, again, not being
6 months. It's 6 months.
Oh, okay. Oh, yeah.
That's my last injection.
I guess your last injection was in September or June? June. Oh, I'm sorry. Okay. My bad. That was me. So, wow, 6 months now. Yeah. Is there any doubt in your mind that if you did get NurOwn, that you think it helped you? Do you feel like you got NurOwn? Do you think you did? And do you feel like it helped you?
I'm convinced that I got NurOwn. I know it helped me. If that's placebo, I'll take it. Sign me up. I'll go get that any day, because I'm fully convinced that if it wasn't for me being in the trial and getting I'm convinced. So I'm just saying, I'm convinced. Wow. I'd be so much worse off. And I know I have a lot of friends out there in the internet world who are worse off, and
right,
it's heartbreaking. And
yes, it is.
I know that
wow.
that NurOwn works, and I know that I would very much like to have more. Now, please, would be great. Yeah,
absolutely. It's the one thing you said there was that if this is placebo, I want more. I think, I believe that almost everybody that I've interviewed literally says that exact same thing verbatim. If this is placebo, then give me more.
Placebo. Mike, and I'm sorry to interrupt.
No, go ahead, please do.
The internet doesn't show the whole picture, and
that's true.
I look good. I feel good. I sleep good. I still I did start using BiPAP at night.
Okay.
But it's more out of a want. It's not. I can take it or leave it. So I'll eat.
Okay.
Walk, drive. I'm still very highly functional. I haven't lost any weight. I don't know what else to say, but I think it worked very well for me. And I think if I would have been able to continue to get injections, every 2 months or every 3 months, I would be spending money on something other than a van.
So there you go. There's Mr. Scott Craig from Reno. Now Scott's actually going to move to Oklahoma next year, and we're going to be buddies here in Tulsa and Broken Arrow area. It's so exciting to hear what Scott said. Scott has done what I think is something that's very smart. He's kept his own data using the ALS TDI's PMP, or Precision Medical Program. He's not the only one. Recently, another very credible, well-known person with ALS named Phil Green did the same thing, kept his own data using that same program. Both of these patients today swear, and have the data to back it up, that they're alive today because of NurOwn. I urge you to make doing your homework on this drug the most important thing that you're going to do over the next couple of months. Learn this drug, learn the data, and help us fight. If this drug is canceled or if it does not make approval, it will be the most tragic mistake ever made, that probably will ever be made in this disease. It will set us back a decade in ALS. There is nothing else coming that has this kind of power, except perhaps, as you heard me mention in the interview, Dr. Appel's procedure, called the Treg procedure, which also halted ALS in trials. Many of you watching this video may not even be aware that ALS has been halted 2 different ways now. One of those you just saw, NurOwn. The second, Dr. Appel's Treg trial, which in phase 1 stopped ALS in all 3 of 3 patients.
At the very least, we had hoped that maybe we would slow the process. We actually stopped the progression of ALS.
That's all he had the money for. Why? And that was 2017 when that happened. And I ask you this, did you know about it? Were you even aware that ALS has been stopped? Even as heterogeneous as this disease is, meaning it's vastly different in each patient, there are 2 drugs right now that are wildly effective for this disease, and we cannot have them. This is a huge, huge mistake. And it's something that No More Excuses has fought and begged our fellow pals to join this fight for 2 years now. We saw this day coming. We knew that eventually there would be effective drugs for ALS that would be arriving soon, but that we would not be able to access, and that thousands were going to watch these drugs be successful without the chance to try them. This is an incredible tragedy, and it must stop. There are people walking this earth right now who would not be here today. I'm confident of that. It's a big statement, but I hope that these people choose to come forward. Scott Craig is one of those people today that you just met who has. If you were in this trial and want to tell your story, just ping me at the address here or reach me at No More Excuses. As a patient, I felt obligated to come forward and to do this because I know this drug works, and I feel that keeping that to myself and not allowing, not fighting, not pushing for this drug to be approved is just a breach of what I see as a duty of mine as a person with ALS for those that will come, that are both here now and who will come behind us. Because this drug, if given to every patient, newly diagnosed, plus some of these other drugs like AMX35 and eventually Tregs, guys, this means that ALS could become highly treatable as soon as we, as human beings, decide to do the right thing. We're not dying today because of ALS. We're dying today because of failure. I want to say thank you one more time. Please come join our fight. We'll show you how to do it, show you what to do, and you're going to meet more people like Scott. Thank you so much for watching today. And I wish you nothing but the best, and I hope that you decide to fight with us. Thank you.